The biggest digestive myth, it's not too much acid. What if I told you that the burning in your chest, the acid crawling up your throat, the bloating, burping, food-stuck feeling is not because you have too much stomach acid? Millions of people take antacids every day, PPIs, H2 blockers, acid reducers, and yet they still have reflux. They still feel bloated. They still can't digest food properly. So today we're going to question something very few doctors ever explain. What if reflux is often caused by a low stomach acid, not high? And we'll talk about how stomach acid actually works, why acid suppression can backfire, the truth behind Betaine HCl and apple cider vinegar tests, who this idea applies to, and who it does not. This is education, not medical advice. Never stop medication without a doctor. Let's begin. What stomach acid is supposed to do. Your stomach acid isn't your enemy. Hydrochloric acid, HCl, has 5 critical jobs. 1. Breaks down protein. 2. Activates digestive enzymes like pepsin. 3. Kills harmful bacteria and parasites. 4. Signals the lower esophageal sphincter, LES, to close. 5. Triggers nutrient absorption. B12, iron, calcium, magnesium. Now here's the key point most people never hear. Stomach acid is the signal that digestion has started. Without enough acid, digestion is incomplete. Food sits, ferments, produces gas, pressure builds, and pressure pushes contents up, not down. That's reflux. The LES valve, the real gatekeeper. Reflux is not just about acid. It's about a muscle. The lower esophageal sphincter, LES, is a valve between your stomach and esophagus. Its job, open, food goes down. Close, stomach contents stay down. Here's the crucial detail. The LES closes properly when stomach acid is strong enough. Low acid, Shankajos, weak signal, Chanajak, loose valve. So instead of acid burning up because there's too much, it's burning up because the door didn't shut. This flips the entire reflux story upside down. Why acid suppressors sometimes make things worse. Acid-reducing drugs absolutely help some people, especially short-term. But long-term suppression can cause poor protein digestion, bacterial overgrowth, bloating and gas nutrient deficiencies, rebound acid hypersecretion. Here's the paradox. You feel relief at first, then symptoms slowly return. Why? Because digestion got weaker, not stronger. Again, this doesn't mean meds are bad. It means they're not always fixing the root cause. Signs: you may have low stomach acid. Many people with reflux actually have hypochlorhydria, low stomach acid. Common signs: bloating shortly after meals, feeling full very quickly, burping after eating food, sitting in the stomach, undigested food and stool, acid reflux that gets worse with age, reflux that doesn't improve long-term with antacids, especially common in people over 35. Chronic stress. Long-term antacid use nutrient deficiencies, the Betaine HCl and ACV tests. The truth. You may have heard of Betaine HCl test, apple cider vinegar test. Let's be very clear and responsible here. Important clarification. These are not diagnostic tests. They are subjective response checks, not medical confirmation. The idea behind them: if adding mild acid reduces symptoms, low acid may be involved. If symptoms worsen or burn, stop immediately. What they are not proof, not safe for everyone, not for ulcers, gastritis, Barrett's, or active inflammation. This is why self-experimenting blindly is dangerous. Why doctors rarely talk about low acid. Because acid excess is easier to treat. Symptoms look identical. There's no simple clinical test. Acid suppression works fast, short-term. Modern medicine treats symptoms first, not always mechanisms. And again, this is not blame. It's limitation. The real root causes behind reflux is usually multifactorial. Stress reduces acid production, eating too fast, low zinc, poor chewing, gut infections, food intolerances, weak LS muscle, poor posture after meals. Acid is just one piece. The balanced take, very important. Let's be crystal clear. Some people do have excess acid. Some people need medication. Some people have both inflammation and low acid. The problem is assuming one cause fits everyone. Reflux is a signal, not a diagnosis. In the end, if you remember one thing from this video, remember this. Acid reflux is not always about too much acid. Sometimes it's about too little digestion. Ask better questions, understand your body, and always work with a professional when symptoms are severe. If this helped you, like the video, comment digestion. If you want to follow up, subscribe for deeper health breakdowns.